Tell us a little bit about your background and what attracted you to the academic discipline of laboratory medicine.
Well, it actually started as an undergraduate. I was a chemistry and biology major and was looking to go to medical school and was doing chemistry senior thesis research. And my mentor at the time told me that if you wanted to see patients, you had to go to medical school, the end of story. But if you want to use science to solve medical problems, that there's an alternative route. And so he directed me to a program at the University of Illinois where I got a doctoral degree in analytical chemistry and began my career in really doing clinical laboratory science. And from there, I went on to do a postdoctoral fellowship in clinical chemistry at Hartford Hospital, who had a program that had been invoked for 20 plus years and had matriculated clinical chemists that were scattered throughout the nation.
So, I heard you speak at the Precision Medicine World Conference, and of all the content that was there, I mean, Precision Medicine World Conference is very much a forward think tank, early adopters, key opinion leaders of what's to come in the area of precision medicine. And of 4 days of content, I gotta say, Dr. Wu, that your keynote was one of the most entertaining and engaging. We'll get to that in a minute, but let me ask you this. Um, I've worked in the industry, precision medicine industry, for over 20 years, and I will tell you that I have over 20,000 hours in the operating room watching tumors be resected from, patients as old as 90 years old and babies as young as 9 months old. And I have followed the resection of that tissue from the operating room to surge path where they're doing frozen sections to the histology rooms to those folks in the laboratory that have to handle that tissue, that preserve that tissue, that make blocks out of that tissue. And when medical questions need answers or a clinical diagnosis is needed when people have, health issues, uh, how often is the laboratory involved in this process? May sound like a dumb question, but how often is the laboratory involved in this process?
Well, we are clearly the medicine behind the scenes. It has been estimated that 70% of all medical decisions, whether it be diagnostic or therapeutic or disease recurrence, are based on the result of one or more clinical laboratory tests. So, yes, we are front and center in just about anything. Maybe some areas like plastic surgery, maybe we're not so much involved.
Yeah. There's a lot of people who listen to this podcast and others that are familiar with, oncology, radiology, surgeons, infectious disease doctors, other specialties such as urologist or cardiologist, and they may not be aware of the fact that all of those doctors ordering tests, they go to a laboratory. And I've heard you say that people just don't understand what happens in a laboratory because, as you mentioned, the 70% of those answers that these treating physicians need to make a decision on what to do for those patients come from the laboratory. And I've got a tremendous respect for laboratorians and the work that goes on there. But in the medical laboratory, I don't think people are as familiar with the role of pathology and what happens in the laboratory that creates the opportunity for successful treatment. But you know, why do you think that is? That they're just not aware?
Well, part of it is because of how the laboratory is portrayed in television shows and popular media, and there is no single advocate for the lab. So you watch a medical show, and a doctor sees a patient and sends a sample off to the lab or conducts a biopsy. And what is then happens? The doctor himself goes to the lab, looks at the slide, makes the diagnosis, and has an aha moment. Okay, that doesn't happen. There are a team of professionals who are trained to do just that and nothing else. Pathologists, laboratory technologists. And then when it comes to the blood tests, so everybody knows that we need to do blood testing for health and for disease. And we'll go see our doctor and we get blood taken and it gets sent to a lab. It comes back a day later, magically, as if nobody had any involvement. It's put into a tube, push a button onto a machine, and voila, results come out. That's not how laboratories are done, or laboratory testing is done. We have a team of dedicated experts who run that sample, determine if the sample quality is good, if the result makes sense, make interpretations. All of these things are behind the scenes that nobody sees.
Yeah, and you've mentioned that medical centers, hospitals, the lab is very much the foundation of the services that they provide. But you've mentioned that these hospitals, medical centers devote about 5% of the operational budget to the lab. Is that did I read that right? 5%, is that right?
Yeah, it's crazy that the impact that we have being so high and the investment into the laboratory is discordant to the value that the laboratory provides.